Hi, I'm Dr. Doug Ehrenberg, and I specialize in pulmonary and critical care medicine. One of my particular areas of interest is the prevention of lung cancer, and nothing is more effective than helping people stop smoking. As a clinic nurse, you play a very important role in the care of patients at Michigan Medicine, and when it comes to tobacco assessment and treatment, your role is truly essential. You see, every patient has a chain of contact within our health system. Medical assistants or rooming staff are usually the first link in that chain. The next link is usually the physician or other provider, and the final link is the nurse who provides follow-up care, medication refills, and answers questions by phone, often long after the visit has been completed. This chain of contact is crucial in helping people stop smoking. When you consider everything that we as healthcare professionals can do for our patient, there's virtually nothing that has the potential impact of helping smokers quit. In order to help our patients reach this goal, physicians and other providers must have accurate and up-to-date information on the patient's tobacco use. Gathering this information is the role of the medical assistants. They identify smokers, record an accurate tobacco use history, and include how much and for how long they've smoked. They also find out if a patient has recently quit smoking, as they are at the highest risk for relapse, but stand to gain the most from the support we can provide. The next link in the chain is the physician or other provider whose job it is to assess a patient's readiness to quit and provide help to those making an attempt. This comes not only in the form of advice and guidance, but also in prescribing FDA-approved smoking cessation medications. As a clinic nurse, you may be involved in some of these tasks, but more specifically, your role becomes most important when a patient making a quit attempt leaves the office. At this stage, you take on the responsibility of follow-up with the patients at critical times during their journey and helping manage prescriptions given by the physician. This connection to you, the clinic nurse, is key in keeping the patient committed to their goal. Evidence shows that contact from clinic staff after an appointment will significantly increase the success rate of patients trying to quit smoking. How you structure the process is up to you, but from experience, I recommend using the built-in tools in your electronic medical record or other messaging system that remind you to make follow-up contact with patients at appropriate intervals after their clinic visit. This contact can be face-to-face, by phone, text, email, mail, or patient portal messaging if available. Some institutions have automated text messaging support for tobacco users making a quit attempt. When it comes to timing, the first contact should be made within the first 2 to 3 weeks following their visit, or 2 to 3 weeks after a quit date if they have set such a date. A second follow-up is recommended within 1 month. You'll want to make sure you leave a note in the patient's chart documenting the contact so others in the chain are aware of the progress. Making contact doesn't have to be complicated or take a lot of time. If making a phone call, it can be as simple as saying, "Hi, I'm the nurse from Dr. Smith's office. Dr. Smith told me you're trying to quit smoking, and I'm just calling to see how things are going and if there's anything I can do to help you." When you're on the call, there are 3 main things you should try to do with all patients. First, ask if they've already encountered or anticipate any stumbling blocks, like a spouse who smokes or a social function where friends are smoking. Secondly, if they're taking medications, ask how they're doing. Less than 10% of patients have concerns about their side effects, but if they do, you could identify alternatives for the physician to prescribe and prepare the prescriptions for signing if the physician agrees. Here's a link you can access that includes a table listing current tobacco cessation medications, their side effects, and recommendations on how to minimize these effects. Lastly, you can schedule your next follow-up contact. For patients who have been successful in their quit attempt, congratulate them on their success and help them strategize to avoid triggers and stressors that might come up. For patients who have relapsed, please be encouraging. Remember, relapses are the rule, not the exception, for people who have quit within the last few years. Help them see their relapse as a learning experience. Nearly every former smoker has made at least 4 or 5 quit attempts before being successful. It's helpful to review with them the circumstances that led to their relapse and encourage them to recommit to the process. If you feel it's necessary and the resources are available, you could recommend more intensive treatment like counseling or calling a toll-free quit line. Finally, one last word about assessing smoking in our patients. Tobacco ravages people's health, and we often blame the patient for their dependence. But I cannot emphasize this enough. Stigma and shame have absolutely no place in this process. When interacting with anyone who has a substance abuse disorder, in this case tobacco users, we must show empathy and encouragement as much as possible. We want our patients who smoke to know we're on their side. When they feel supported, they're more likely to accept our help. So thank you for both your compassion and your attention to detail as you work with your patients. As we emphasized in the beginning, clinic nurses are the final link in the chain of contact. The stronger you are in your role, the stronger the whole chain will be, and the greater impact we can have as a health system in helping our patients battle nicotine dependence.